Well, by this time next week, millions more Washingtonians will become eligible for the COVID vaccine.
Yeah, starting on Thursday, anyone that's 16 years or older can now sign up to get a shot. However, many people are still feeling hesitant about getting one. According to a recent poll, a majority of people say they are planning to get vaccinated or they've already received their shot. But listen to this. Almost a quarter of folks are still hesitant. And of those who are hesitant, 70% say they are most concerned with side effects.
So we just want to take some of your questions and take them straight to the experts. Dr. Deborah Fuller from the University of Washington is joining us live today. She's a vaccinologist and actively studying vaccines right here in Washington. So first, we just want to say thank you very much for joining us, Dr. Fuller. We appreciate your time and, of course, your expertise. Let's just start there with what seems to be a lot of people's biggest concern, those side effects, because we know that some people will experience something. So what do you know about the most common side effects, and when do those side effects, I guess, become serious enough for someone to actually not get this vaccine?
Well, most of the side effects actually occur after the second dose. Some people feel a little bit of maybe soreness in their arms, sometimes a headache after the first dose. There's a lot of people who will get the first dose and not feel anything. In the clinical trials, it's around 30% of people actually feel more side effects after the second dose. And that's where you might even develop a little bit of fever, a little bit of chills, feels like you're kind of coming down with something. And that's just telling you your immune system is working. It's developing an immune response. For the majority of people, though, that's going to resolve within 48 hours.
Okay, Dr. Fuller, I have kind of a three-parter for you here. First is, how many people need to get vaccinated for us to get herd immunity and for this thing to go away? And do people who have already had COVID, do they even need to get the vaccination, or do they have the antibodies in them? And then my last part of that question is, are we going to have to get booster shots every year now?
Yeah, those are great questions. First of all, the herd immunity number is sort of, it's been set out around 70% or so, but it's really kind of one of these numbers that can change. And what really influences herd immunity is how effective our vaccines are and, how transmissible the virus is. And so as you've heard, some of these variants that are coming out are more transmissible, and that sort of kicks the can down the road a little bit. I think what we're looking at more, though, is that we're starting to vaccinate some of our most vulnerable people in the population, people who would be hospitalized if they got infected with COVID-19. And I think much quicker, we're going to start to see a significant impact in the reduction in severe disease and hospitalization and death associated with this virus. Getting to the point where we have herd immunity, where we're protecting even unvaccinated people. That's something that we're still going to have to see how the new variants emerge. So with regard to the question about whether if you've gotten COVID-19 before, you definitely should get an immunization. What we're learning in studying the immune responses to COVID-19 versus the vaccine is that the immune responses induced by the vaccines are actually better than the immune responses induced by an infection. After COVID-19 infection, immune responses can actually persist for a lot shorter time. They actually wane more quickly than what you see with the vaccine. And so you want to have that sustained immunity. It's really important to get an immunization. What's interesting is there's a recent study showing that individuals who were treated and exposed to COVID-19 after only a single immunization with an mRNA vaccine actually developed robust and broad immunity against the coronavirus variants that are out there. And so I think that should encourage people actually to go and get that vaccine, because it looks like the vaccines are doing a bit better than nature in terms of immunity. And I can't remember your last question.
I was just, are we going to need a booster every year?
Yeah, so that's a big question that's out there. We anticipate that SARS-CoV-2 will go endemic, meaning it's going to probably persist in the population somewhere in the world for a while. And that's just because, we're in a race between getting enough people vaccinated out there and to slow down the spread of the virus. So as long as the virus is replicating somewhere, there's always the chance it's going to introduce additional mutations. and those mutations can potentially reduce the efficacy of our vaccine. So already the manufacturers are updating the vaccines to better match some of these current new variants that are emerging, and we may need to come back and get a booster immunization to sustain our immunity against some of the new variants that we're hearing about coming out of the
It's very interesting. I'm curious, and we have heard from quite a few people who say they kind of want to wait and see what the longer term effects are. I'm curious if this vaccine was modeled after others so that we know at least a little bit about kind of how this type of vaccine works, or is there some concern about some impacts that may not present themselves right away?
Yeah, that's a great question. So it just seems like this vaccine came out of the woodwork when COVID-19 came all of a sudden. For the first time, a lot of people are hearing about mRNA vaccines and about adenovirus-based vaccines, viral vector vaccines. But in reality, these vaccines have been in development and in clinical trials in thousands of people for about 7 years. So we have a lot of data now with other infectious diseases in terms of their safety, in terms of their efficacy. And so there's a lot more knowledge about them in terms of their long-term effects. And so I think to some extent, that's why these particular vaccine platforms were able to be leveraged very quickly for COVID-19, because there was already a wealth of data out there understanding how they work and their safety and their effectiveness in humans.
Always fascinating. Dr. Fuller, thank you so much. I think that clears up a lot of the main questions that we've been hearing about each and every day. So again, thank you for your expertise. We definitely appreciate your time tonight.
It was my pleasure. Thanks for having me.